also a political question. It was also an economic question. It was also a religious question. It was also, so you can go on and on. So everybody becomes a specialist. Also a political question. It was also an economic question. It was also a religious question. It was also, so you can go on and on. So everybody becomes a specialist. Also a political question. It was also an economic question. It was also a religious question. It was also, so you can go on and on. So everybody becomes
I can't understand
a specialist. Also a political question. It was also an economic question. It was also a religious question. It was also, so you can go on and on.
Hold on, bro.
Okay.
Okay.
All right. Sorry about that. I started to hear myself and I wondered what was happening. Okay, so that gives me a signal to stop now. The last point is that it provided it was a methodological challenge for research. And for instance, people begin to take seriously, virtual methodologies. But it also enabled us to begin to have plan B and C, how to do research. And I think Dr. Osayami's presentation today is quite instructive in a way that shows us that the COVID pandemic was not just a methodological challenge, but it was also a challenge for theory. So today he will be speaking about deconstructing the African COVID-19 paradox, some attempts at theorization. So I just wanted to throw out those footnotes, and I think that he will be properly introduced by Dr. Baba Timehi. Am I correct? So
no, I'll do it from here, sir.
Okay, all right. So welcome, and hope you enjoy this conversation with Dr. Osayami.
Thank you, Professor Adegame. Thanks for always being there for us, just for audience that today we are having, just to repeat, Professor Adegame had given us quite a number of things about COVID and what had transpired from it. Some are still within that space that they are still within COVID era, even though so many people had moved outside of COVID. But today, we're having Dr. Tolulope Osayemi speaking to us on deconstructing the African COVID-19 paradox, some attempts at theorization. We know he just came back from Oxford, where he was a visiting scholar, University of Oxford, where he was a visiting scholar, and it was a wonderful time that he had there. And let me just quickly introduce our speaker for today. You know him, but permit me to follow the protocol. Tolulope Osayemi is a senior lecturer in the Department of Geography at the University of Ibadan, Nigeria, and is currently a Fox Touch visiting scholar at the University of Oxford with a PhD in health and medical geography from the University of Ibadan. His area of interest comprise of disease mapping, the spatial epidemiology, spatial demography, and global health. In response to the COVID-19 pandemic, his research focus swiftly shifted to the geography of pandemics, with particular emphasis on its interpretation and impact on African societies. I don't want to waste too much of our time. You can read more about Dr. Tolulope Osayemi from the IIAS website, and I would open up the space for him now to give us the dish that we've been waiting for on deconstructing the African COVID-19 paradox, some attempts at theorization. And we'll be bringing up Professor Oyekanmi Babatimehin, who will be responding to his presentation today. Over to you, Dr. T.
Thank you very much, Dr. Oye. Good evening, everyone. Thank you, Professor Adogame, for presiding over this webinar today. And I also want to thank everyone who has made it to be here. I appreciate your kind presence. Thank you so much. I believe you can see my slide before I say anything further.
Yes, we can.
Okay, thank you. So as Dr. Oye rightly said, the title of my presentation is Deconstructing the African COVID-19 Paradox, some attempts at theorization. And this is actually a product of my fellowship project at the University of Oxford. And I felt that I should also see this as a kind of feedback seminar since I returned. But before I go into the presentation itself, I also want to give express my gratitude to IIAS for the gift of perspective. One of the things I took away, or one of the big gifts I got from the IIAS is the lens of interdisciplinarity, and that has actually helped me and also shaped and also sharpened my perspectives and also my research. And I am so happy that it actually yielded dividends, and one of it is this AFOX fellowship, which I got tail end of last year, which is currently on, which is on till the end of this year, 2024. It would also please you to know that I'm not the first AFOX, the first to get the fellowship. The first was by Dr. Olusegun Titus. I'm sure many of us in the community know him very well. So he was the first in our community to get it. And I'm happy to be the second. And I do pray that many more will follow from IIAS and also other Nigerian universities too. Apart from the visiting fellowship scheme, there's also this travel travel grants scheme, which is also being financed by AFOX. So Professor Tunde Decker is a former recipient of the travel grants, and also Dr. Morufu Omigule, whom I actually bumped into on my way from work. Actually, I didn't know that both of us, our offices were along the same road in Oxford, so it was a great delight to see him. I know if he sees this picture, he's going to call me after this seminar to request for this photograph. So it was so great to see him on that day. So we were your ambassadors at Oxford. So to the presentation itself. Before COVID-19 reached Africa, many on the continent thought it would remain a localized outbreak far away. However, widespread apprehension swept across Africa, fueled by horrific images of overwhelmed healthcare systems in Europe and North America. Africans feared that the same virus could devastate their generally weak healthcare systems. Notable figures and international organizations expressed grave concerns about the pandemic's potential impact on Africa. As a matter of fact, the UN Economic Commission for Africa projected 1.2 billion infection cases and 3.3 million deaths in Africa without an adequate response. The WHO identified South Africa and Nigeria among the 13 transmission hotspots on the continent. Melinda Gates predicted a crisis of significant proportions for Africa, comparing it to the situation in Ecuador, where bodies were left on the streets. It is going to be horrible in the developing world, she said. Look at Ecuador. They are putting bodies out on the streets. You're going to see that in countries in Africa. End of quotes. This remark was strongly resented and condemned both offline and online. Contrary to these frightful projections, Africa emerged as the least affected continent in terms of morbidity and mortality. By 2020, December 27, 2020, Africa recorded 1.8 million infections compared to the Americas, 34.8 million, and Europe's 26 million. This unexpected outcome turned the African COVID-19 paradox, sparked curiosity and debate. At the heart of this phenomenon lies the question, why was Africa spared the envisaged adverse impact of this virus? And I so much love the footnote that Professor Adogame gave a while ago, say that the crisis, as we know that many people lost their lives, but it also gave birth to innovation and creativity. And one of those creative, innovative projects was this. I established the COVID-19 mapping lab at the University of Ibadan, Nigeria. This virtual space and collaborative research team provided daily and weekly updates on COVID-19 in Nigeria and West Africa, as you can see on the screen, complementing the efforts of the Nigerian Center for Disease Control Agency and the ECOWAS Center for Disease Control. A seemingly casual geographic observation, as you can see on the screen, evolved into a big mystery, leading to various attempts at theorization. Notable personalities such as Bill Gates were puzzled, and while media houses such as the New York Times and the Guardian newspaper, Nigeria, made bold attempts at theorization. Even the British Broadcasting Corporation, BBC World Service, expressed surprise that, and I quote, infection and disease rates in many African countries have turned out to be much lower than initially feared, end of quote, and pushed forward the wild speculation, could poverty be a vaccine against COVID-19? An idea that received outrage and criticism. As you can see here, one of these is, they said we will die because we are poor. Now they are saying we are not dying because we are poor. Inspired by this, again, I saw an opportunity here, a research opportunity, which was inspired by this controversial hypothesis. My colleagues and I, who you saw a while ago at the University of Ibadan, empirically tested this claim, and it revealed a weak negative association between COVID-19 and poverty. And the findings have been since published in the Journal of Earth Systems and Environment. Thus, the question remains, why was Africa spared? Sadly, our poverty in the eye of the world is the single story of Africa. Chimamanda Adichie warned of the danger of a single story, which creates stereotypes by flattening experiences and overlooking the many other stories that form a complete picture. In her words, and I quote, to insist on only these negative stories is to flatten our experience and to overlook the many other stories that formed me. The single story creates stereotypes. Problems with stereotypes is not that they are untrue, but they are incomplete. They make one story the only story. And this actually reminded me of one of my favorite Yoruba proverbs, which is Onokan Woja, which translates to multiple roads lead to the marketplace. And also the Igbo saying about dancing masquerade, which says the world is a dancing masquerade. If you want to understand it, you can't remain standing in one place. Underscores the importance of multiple perspectives when viewing issues. The world-claimed writer Chinua Achebe emphasized that understanding requires seeing from different viewpoints. The masquerade is moving, as he said, is moving through this big arena, dancing. If you are rooted to a sport, you miss a lot of the grace. So keep moving. And this is the way I think the world story should be told, from many perspectives, different perspectives, end of quote. So through these lenses of the epistemologies of the global south, I argue that the African COVID-19 paradox attests to the potency of the African agency in the co-production of global health. Building on my research for the AFOX Touch Fellowship at Oxford, I highlight how this phenomenon challenges some erroneous Western-centric ideas by showcasing Africa's ingenuity and resilience. And the findings are as follows. But before then, it's also pertinent to note that the African COVID-19 paradox defies a single explanation. Multiple factors contribute to Africa's lower history with Ebola, HIV/AIDS has equipped the continent with tools to combat COVID-19. Despite our fragile healthcare systems, significant advances in infectious disease control were made by African scientists, such as, hello, I don't know if you can hear me.
Yes, we can hear you, sir.
But you were
All right.
that's some breaks earlier on.
Okay, sorry about that. So I will take it again. So despite fragile healthcare systems, significant advances in infectious disease control were made by African scientists such as Christian Happy, Amadou Sol, and Iruka Okeke. The second is limited testing capacity. It was noticed that variations in testing rates likely led to the underreporting, and Dr. John Nkengasong, who at the time was the Director General of the African Center for Disease Control, noted that Africa only conducted 1.3 million tests in a continent of 1.2 million people. The third explanation is the late onset. The late arrival of the virus in Africa allowed time for emergency preparedness and also to learn from Western countries. And Africa's history of effective epidemic containment proved advantageous. The fourth is the youthful population. Africa's median age of 19.4 years, with over 60% under the age of 25, might explain lower mortality rates. Younger populations generally experience milder or asymptomatic infections, as clinical evidence has shown. This view, in my opinion, is further strengthened by my argument based on the observation of the relatively lower numbers of infections following the massive, and I repeat, the massive youth-driven NSAS protest in Nigeria in October 2020. Again, I so much appreciate the footnotes that was given by Professor Adogame, which also, again, attests to the spirit of innovation and creativity. And as he rightly said, the pandemic inspired remarkable acts of ingenuity. In Ghana, a professor and his students built low-cost ventilators. In Nigeria, two volunteer engineers, refurbished obsolete ventilators in some of the teaching hospitals in the country. These and many more initiatives demonstrated resourcefulness during the crisis. Number 6, herbal remedies. Local medicine systems played a role in patient recovery. As you can see, Madagascar's COVID organic herbal cure attracted attention, though the WHO emphasized the need for scientific validation. In Oyo State, where the current governor, Governor Seyi Makinde of Oyo State, reportedly tested negative after using a herbal mixture of black seed oil and honey. Faith and religion, the last. Faith and religion. Africa's deep religiosity provided comfort and community and resilience during the pandemic. As you can see on the screen, you would see that we all agree that we are deeply religious people. And in response to Bill Gates' inquiry about why it had lower impacts in the country, in the continent. The pastor of one of Africa's largest mega churches, Pastor Enoch Adeboye, attributed Africa's low mortality rates to divine protection. And as you can see on the screen here, this is a quote he gave at a public event. He says, "We have no money, we have no resources, but we have God. They expected us to be dying like flies, but we have a God who says that he dwells in the secret place of the Most High, will be under the shadow of the Almighty." My conclusion: poverty is not the single story of COVID in Africa. Africa's experience needs to be told from multiple perspectives. Moving away from the notion of a passive recipient of global health, we must redefine Africa's positionality. Identifying and developing what worked for us on the continent can tuition the rest of the world on the significance of African agency in the co-production of global health. As the saying says, until the lions have their historians, the history of the hunt will always glorify the hunter. Thank you very much.
Thank you so much, Dr. Osayemi. I know there are questions, but first, I can see so many clapping emojis and love. So much love shared with you, Dr. T, today. And thank you so much. Thank you so much. That was a brilliant, short, sharp, precise presentation that we have here today. And our respondent today is Professor Babatime. And I know he's been having some challenges to come up. Just give us a few minutes. Just give me some few minutes or a few seconds to get this wrapped up with. Toby.
Dr. Tayo?
Okay, are we live?
Yes, so yes, not totally. We might be able to hear Professor Babatime.
It's still better.
He's still having issues joining, but you
It's
would
okay.
like to say a few words. So, Prof, please go
It's
ahead.
okay. Sir. Okay, Prof. Let me first introduce Prof. Prof, let me first introduce you, sir. It's very, very, very briefly. Professor Oyekomi Babatime is a professor of medical geography, and he has in Obafemi Awolowo University, Ile-Ife, Nigeria, and he is also he has served as a member of Service Availability Mapping Steering Committee of the Federal Ministry of Health, Nigeria, in 2005, and representative of the Nigerian government on. He was a representative of the Nigerian government on the Governing Council of Rectors in 2013 to 2015. Professor Babatime also is connected to Codestra in Dakar, Senegal, and as a content reviewer on so many other, several other journals. And as you said, he has several publications in reputable outlets worldwide. Join me in welcoming Professor Oyekomi Babatime, who is a respondent for Dr. Osayemi's presentation today. Professor.
Yeah, good afternoon, everyone. I just want to hope that you are hearing me. And I must apologize for the connectivity challenge we are having today. We don't know what explanation to give for that. Thank you, Tolu, for this presentation, though I was not opportunity to listen to the presentation, and the one-page document sent to me. I've tried to look at it, and also appreciate the succinct presentation you have. We have in there. You see, as we're having the COVID-19 outbreak, I happen to be the chairman of the standing committee of congregation in my university at that time. And immediately we saw it coming, we quickly called an emergency meeting of the standing committee of congregation to discuss it. Interestingly, on that committee, then we had two medical personnel, Dr. John Ukeni, who now is the CMD of Obafemi Awolowo University Teaching Hospital, and Dr. Ogunlade. Both of them are professors now, who is a cardiologist. So we discussed at length, and at the end of the day, the committee just decided that the thing to do, even at level of preparedness and what have you, that the best thing to do was to go on a mandatory recess. And immediately we came up with a memo to that effect to the university administration, who interestingly were holding a meeting next door to us. And immediately the VC invited us, and we presented our paper to them. Then we're just coming out of a strike in our university. And it was like, what are these guys saying? Is it that they really don't want us to do anything in this academic session? Our request for a shutdown was not accepted. But interestingly, before the end of the day, a directive came from the federal government asking that the universities be shut down. And honestly, I wouldn't know how to describe what I felt. But sincerely, I had a very, very strong relief with that. One, because as a medical geographer, I was like, look, we're not prepared for this kind of thing. And the best thing was for us to send these children to their parents for better management too. As chairman standing committee of congregation, it was going to be embarrassing that we came up with this and the university administration was turning it down. Now, the point I'm trying to make is, whatever it is, whichever way we want to look at this thing, we might be thinking we're not prepared and whatever. But you see, some little efforts we made actually went a long way in curtailing whatever magnitude of seriousness that the COVID-19 was going to pose. Yes, they might not be enough, but then it's not as if everybody was just waiting and allowing the thing to come hit us without us being able to do anything. We did the best that we could, and in fairness to the system, somehow centers were hurriedly put together, ventilators found here and there, and what have you, and well, like Tolu put in one of his possible possible explanations that the spiritual aspect of it maybe not, but then thank God we took some of the steps we took, and like he also proceeded some of the remedy. I mean the herbal remedies. We can't just downplay some of these things. You see, COVID-19. It's basically believed around here to be a kind of flu, which was never going to be serious around here. Perhaps he didn't mention it, but perhaps maybe part of it is the weather conditions around here. Whether we like it or not, our tropical environment also has some role to play when it comes to dealing with infections in the form of flu and water. These things have never been serious amongst us around here. During the COVID-19 pandemic, I had the opportunity of traveling to the village all through from here to Kogi State and my village. From there in Ife to my village in Kogi State. Getting to the village, nobody knew anything was happening outside there. Sincerely, nobody knew anything was happening outside there other than they being embarrassed that they couldn't travel, they couldn't do the things that normally they should be doing. Again, when you look at it, let's look at what's it called now? The Ebola experience. Yes, we had thought Ebola would come and wipe us away and water, but somehow we were able to curtail Ebola as much as possible. And today, those things no longer constitute a serious health problem. Whatever it is, I think we shouldn't look down on some of the little things we put in place, as particularly Lagos State. Lagos State did so well in combating COVID-19. Here in Osun State, the Osun State government did very, very well, monitoring movements, putting health facilities in place. I remember the university, in my university, a number of things were put in place. All of these basic hygiene things, wash your hand, do this, don't do that, and what have you. We should not downplay all of those in explaining the way we're able to rally the COVID-19 pandemic. Gentlemen and ladies, if you are hearing anything I'm saying, I'm not sure I will be able to make further contributions than this, other than again to appreciate the people that have put this together, and particularly to appreciate Tolu for the presentation. I wish I'm able to be a part of the discussion the way I would have loved it. Perhaps my contributions would have been would have been much more meaningful. And to the organizers, I thank you for this opportunity. And honestly, I look forward to another opportunity where I'll be able to make some more meaningful contributions. Very sorry for this disappointment, but I hope to have the opportunity to make it up subsequently. All the things that were sent were actually sent to a wrong email, which I've not been using for a very long time. Thank you very much.
Thank you, Prof. We heard everything that you have said, your response to it. Thank you so much for your response. And it's if there is anything, quite a number of us may not have control over. Technology sometimes just develop its own wings and fly just beyond our reach and decide to do what have its own life, and one way or the other that we will not be able to get that done. But technology still give us that way out that we're able to hear you today. But the discussion continues. If in case any of our audience would like to ask a question, please kindly use the emoji raise hand, or put your question in the chat box or in the Q&A, and we will be able to get that across, read it, and then we can continue with the conversation. While we wait for that, I don't know if Professor Adogame, do you have any contribution or thing to add to the ongoing conversation, sir?
Yeah, I think since I started with footnotes, I want to space for others to contribute. But congratulations, Osami, for this very interesting presentation. Perhaps while we are waiting for others to come in, maybe I could raise these 2 points. First, maybe it might be helpful to because you started doing some kind of mapping with your colleagues, which enable you to frame this as a project. So I'm just wondering if you could share any insights about the methods you used in gathering this data that led to the kind of conclusions, the very interesting points you itemized. How did you come at that? I mean, again, coming from geography. So that is one point. The second point, perhaps to reflect a little bit more about while those indices that were raised were to support the fact why COVID didn't spread so much as compared to others. Maybe to turn the coin, might it be interesting also to look at how what made it spread the way it did? And I'm thinking of issues around self-denial, the impact of conspiracy theories, and those kind of issues. So again, that might help to balance. While on the one hand, it was not sporadic in terms of demography as compared to the US and elsewhere, but it did spread. So what made it spread the way it did, in a way that it could have been even better, mitigated? So those might be 2 things, maybe just to get us thinking.
Yeah.
Yes.
So would you like to go with that before I read the other question and also add one more question to that? I think you can just I should read the other one.
Yeah, please go ahead.
Okay, so Latif Olatunji, okay, I think he's says thanks for the wonderful presentation. Prof, I could understand that Chimamanda's single story will stand as a theoretical frame, as a proverb. Different roads leads to the market, and Achebe's idea of understanding a dancing masquerade further explain this. That's one. I also wanted to just ask this, just like our proverb says, how would you explain?
We'll have to translate that for
yeah.
non-Yoruba.
Well, it's a proverb that relates to double tragedy, that you don't experience 2 sufferings at the same time, especially for someone who doesn't have anything at hand. So how do you explain the issue of poverty existing, and then there is nothing? I mean, where there are more poverty, you have less of COVID-19 occurring there, and because people just needed to just go out. I mean, I could experience while COVID-19 was going on, people defied all laws because they all want to eat. And at the marketplace, if you wear any face mask, you are the real person spreading the spreading the COVID-19, not them at all. Because I could remember going to Ibadan. I was at Dugbe and wearing face masks. I mean, they were literally running away from me. And so, that is, I mean, if you can just shed light on that. And I think someone raised, I saw it. Okay, Ibokun Olodude raised his hands. Ibokun, would you like to talk now? Can I ask a question?
Yeah, thank you, Dr. Tayo. And thank you, Dr. Sayomi, for the very wonderful presentation.
Thank you.
Well, let me just start on a jovial note. I recall during the COVID, a lot of proverbs came into the fore, and then there is one tag that ship away. There is this popular proverb that carrying kapo, yeni lo yeni. Oh, that's the normal proverb. But suddenly during COVID, it became carrying kapo, pipani lo pani. So it was
So
a
you
kind
have
of
to, I think you also have
Translate
to translate that.
well, normally that when you work together, it brings a kind of togetherness and some form of goodness. But during COVID, when you work together, of course, it results in death. That's the concept of the social distancing and the rest that came during COVID. Well, the major point I want to make, thankfully, I also did a research on COVID and then the Yoruba worldview during this COVID era. And there are 2 points which I also discovered and which I would love Dr. Sayomi to respond to if his research also brought that out to the fore. Well, for instance, part of my research, in fact, I went to the center. There is this center at Redeemers University there, the Center for Genomics Disease and something like that. It's a major center that handled COVID issues. It was a major testing center. And one thing I discovered, according to them, was that there was a massive case of underreporting of deaths and those who got entangled, who got the disease. So I don't know, the concept of underreporting in Africa, I think it's one major fact also that undermined the number of COVID cases in Africa and then in Nigeria in particular. So you could possibly speak to that. And then there is another concept also with the Yoruba worldview, or people generally in Nigeria and Africa believe that the disease was elitist. And if you look at quite a number of those who got trapped in the disease, probably who got infected or even died, most of them were in the elite class, sort of. And that's similar to what Dr. Tayo just said now, the concept of poverty versus the disease. So from these two angles, one, the disease being seen as a kind of elitist disease, a disease that affects the elites and then does not really affect the masses on one hand. Then two, the concept of underreporting. There were a lot of people who got infected but were unable to visit maybe hospitals or the treatment centers to get enlisted and then get registered and their names to go into the number of those who got infected. So from these two angles, I don't know what's your opinion and what your findings, how they either correlate or about this view. Thank you.
Thank you. Ibukun was also one of our IIAS small grant recipients who worked on COVID-19. Kosi Koro was actually, I think, Obani Koro was actually,
Obanikoro, Gengas
yeah,
COVID.
yeah. So was his the title of his research. So and the last, oh okay, oh. Well, Ogati, so you have some more questions coming up. Today is your day. So, Dr. Telu, wonderful presentation. What about the claim of the use of malaria drugs during the COVID pandemic? Did the research look at the controversy at the time that was centered on Stella Emanuel? And Ekene Nwankwo says, what would you say about the speculations of COVID-19 being a higher level of malaria? I heard at some point that Africans are used to malaria. Do you have anything to say about this? I think both can be combined together. So then Ademola Ade Shola says, I'm grateful to you, Dr. Osayemi, for sharing your work with us. For me, it is a paradox element of the presentation. It manifests in the words and actions of religious leaders. More importantly, your presentation underlines one of Professor Adugame's footnotes, this being that phenomenon, this being that phenomenon such as COVID are sites of paradoxes. So I think that was a comment. So over to you, Dr. Osayemi.
All right. Thank you very much, Dr. Weye. And I want to thank everybody for the very, very helpful comments and also very interesting questions. First of all, I want to thank Professor Babatime, whom I've known for a very, very long time. He's my mentor, and I first met him when I was doing my internship at the Nigerian Institute of Social and Economic Research as a third-year student at the University of Ibadan. So I'm very grateful to him for his mentorship. The point on the weather conditions is taken. Actually, it's actually one of the possible explanations. And as a matter of fact, it was observed that there were higher levels of infection and deaths in the northern, extreme northern and southern tips of Africa because of the Mediterranean climate that they enjoy. So that might explain why they had higher levels of infection and deaths. On the Stella Emmanuel, I don't recall hearing anything about Stella Emmanuel. Maybe you might provide a bit of context to that. Yes, the COVID-19, when it was circulating around the globe, some people said that it was a disease, and I like this description that was used by some authors in Germany. It was a disease of the internationally mobile elites. All right, so it was, and if you look at the index cases that were reported in many African countries, they were among foreign travelers. For in Kenya, I know that I think in Kenya or Tanzania, they said COVID is for the Anguzu. I think there's a Anguzu, which means stranger or visitor or foreigner. So that was the way. These were some of the sentiments or comments that informed societal perceptions in many African countries. Yeah, the seroprevalence of COVID was, according to clinical research, was high among Africans. But what was surprising was that people were not dying. So the question again was, why weren't people dying? All right. And if people were dying, where are the mass graves? All right. That was the viewpoint of a top-ranking health official in one of Africa's, the health ministries of an African country. He said, if you claim that people are dying, where are the mass graves? We don't see the mass graves. All right. So I recall even at one of my seminars at Oxford, a gentleman, an African.
Hey, this is done.
Let's just meet. I've not left market since.
All right. So I recall that an African student approached me and they said that there were actually speculations that people were really hoping that people would die as a result of the COVID in Africa. And I mean, aerial drones were being launched to look for those mass graves, but I don't think they found any. So to me, I feel that, yeah, that doesn't rule out the fact that some people die. Yes, don't get me wrong, but they didn't die as it was envisaged by, the Bill Gates, Melinda Gates, and they didn't see the body bags on the streets, really. Yeah, and I want to thank Professor Adogame for that, for actually throwing a challenge to me. Actually, the best response I'll give to your question is that in the publication my colleagues and I co-authored, in the conclusion, we did say that why don't we look at it? The problem shouldn't be why was Africa least affected. The problem should be why was it that the Western world, which was more developed or the most developed, why did it have? Because it had the infrastructure, to contain, it had the infrastructure to control, and even probably prevent too. Why was so? we then say that we could actually see this as a Western anomaly, right? So, but it's still food for thought, really, about the self-denial and all of that. It's something, again, this is still an ongoing project, and it's something I would really like to explore. But even within Africa, looking at the geographical dynamics within the continent too, you would say that it was a uniform, it wasn't even, it wasn't uniform. There wasn't that uniformity really. South Africa, which is the largest economy in the continent, had the highest, and it's, of course, we know that it has a comparatively strong economy, but it had the highest. So the question was why, really? And so today it still baffles me, and I still hope that some light will be shed on that. Sorry, I forgot to mention the approaches, methodological approaches that were used. So one was disease mapping. It was a mixed method approach. It involved disease mapping, and that is creating maps showing the distribution of diseases, of COVID in particular, and then also digital ethnography, looking at online sources, social media, memes, cartoons, and then also content analysis of newspapers, and then also social media analysis, and then also some library research too as well. Yeah, I think, Dr. Way, I think I've covered. Is there anything I've left out?
I think you have covered all the bases. I think at this point, because there are no more questions and we are 8 minutes on our time. We're supposed to be from 3 to 4 p.m. Sadly, I apologize for starting 5 minutes late, but that's it. We want to appreciate everyone for coming today. I would like to give the closing remarks to Professor Afe Adogame, who was been standing in for Professor Jacob Olukono, who today they are having their convocation in Harvard as we speak at the moment. And Professor.
All right, no. So I think first is to thank all of you for being part of this conversation today, but most particularly thanks to Dr. Sayami for sharing some of your research work, and as the work is ongoing, we wish you giant strides, and hoping that we can see more beyond that article. Maybe perhaps a book is forthcoming on this, which would be a very welcome one, of course. Maybe in a lighter mood, I gave footnotes, so let me do an end note, which perhaps helps us to see the multiple impacts of COVID. And I was just thinking about how it changed the etiquettes and social attitudes, for instance. And the immediate one that comes to my mind is the one you recall that in many social settings, when you sneeze, before COVID, when you sneezed, the response from many people is, "Oh, God bless you."
Bless you.
Bless you. Bless you, you know. And then during COVID, that kind of etiquette, that changed to when you sneeze in public places, people either say Holy Ghost fire or Jesus. So you see how a crisis like that can actually also change our social etiquettes and attitudes. So yeah, that is in a lighter mood. And thank you all for coming, and we hope that you will be part of the forthcoming webinars and other programs of the IIAS.
Thank you, Prof. I also like to thank everyone for coming today. Remember, for those who are from the science background and even from the social sciences and humanities, the IIS science call is still out, and it will be coming up November 19th to 23rd, and it will be strictly virtual, fully virtual online, and you can go to our website, or to any of our social media platform or get across to the secretariat to share the call with you. And there are so many people who are actually registered now. So if you have not done yours, you still have time. And there is also the IIAS Science small grant, which you can also apply for. So thank you for the amazing attendance that we had today. And the next webinar, the October edition, will be coming up 31st of October. Am I right? Dr. Simon, so you'll be coming back to your role as the webinar coordinator. Thank you so much. Well, we'd like to thank everyone for coming, and please do have a nice and wonderful rest of the day. Bye-bye.
Thank you, Dr. Simon.
Hey,
you very
Mama
much.
T.
Thank you, Prof.
Okay.
Well done, how's everything?
Yeah,
Okay,
yes. You're welcome. That was great. Yeah.
Thank you very much.
short, straight, and sharp.
Thank you so much.
Abati, Umbowo, Adukalo,
You've abandoned your boy.
No, na the mountain we do here, no, na be see the mountain we dey far.
The Scotland mountains, no, they you serious.
Is in fact, it dey high, and the students are in now.
Oh, that's true. That's true.
Toby, cool technological kini.
Manipulation.
You know what you first do. Janet, do what you
Good
used to do.
afternoon, sir. I'm
On the
on
other
it, sir.
side.
Okay. Anyone that wants to
Mama T,
Auntie T, good afternoon, ma.
Good afternoon, sir. Well done, no?
Welcome. Welcome back. It's nice to hear your voice.
Oh, God.